I was at a conference a couple weeks ago, and Dr. Oz was there and was talking about, it was his first, as I understand it, public appearance since being confirmed. And he was talking about the Make America Healthy agenda, the MAHA agenda. And I think for many of us who've been in healthcare for our careers, there's so much of that that's deeply appealing, that we know while we lead the world in innovation, we are falling tragically behind in health and in the length of our lives and in prevention, all those things. So I'm just curious for you, with all the perspectives you've had, with all the experience you've had, what would be your Make America Healthy Again agenda?
First of all, let me just say, I bet you didn't know this, by the way. Dr. Oz is a Duke man also. He did his surgical internship at Duke and then went back to New York and had, he was a very good cardiac surgeon. I'm a cardiologist, so, and a very smart guy. But in general, what I'd say is we got the right problem, but the wrong solution set being offered, at least from what I can see right now. It's been a big part of my career to proselytize on the idea that we are the leaders in innovation and new technology development. Among all large high income countries, we're in last place in application of that technology for health benefit. We have the shortest life expectancy, and as you point out, the shortest healthy life expectancy and a much larger burden of chronic disease. We also have problems that we refuse to even acknowledge. Gun violence. There's a really great study from AAMC, the Association of American Medical Colleges, that points out if you look at the 4-year gap between the U.S. and other high-income countries, which is hard to even say, isn't it? We have a 4-year shorter life expectancy now. Half of that is gun violence, overdose, and suicide, and alcohol. So those are not going to be solved by some direct medical intervention. They involve other social services and policy approaches. But the biggest thing in the other half is cardiometabolic disease. So this is my specialty. And I'm sorry, but the solution to cardiometabolic disease is not nutraceuticals and more vitamins. It is healthy food and exercise. And so exercise, I think almost everyone agrees on how much and in what circumstances, how do we make it possible for people that live in dangerous neighborhoods, for example, to exercise. People like you and me can go to the club and do our workouts with a trainer, but a lot of people can't. But healthy food is a red hot issue. It should be. I've already mentioned there's nutrition and there are chemicals. Right now, the easiest food to eat in the U.S. for everybody is unhealthy food. We make it really easy to do it and make it really inexpensive. If you want healthy food, you got to pay more here, and you can't get it in a lot of places, especially people that don't have a lot of money, because the Whole Foods and other establishments like that are very good using geospatial mapping to decide where to put their stores where the high-end customers are. So that's a set of things. But, one that people don't talk about enough, in my view, is generic medicines. If we look at cardiometabolic, you can think of this as like a stew that Americans are living in now that includes too many calories, or so too much weight, too many carbohydrates, so glucose concerns, high blood pressure, use of tobacco, and lipids, your cholesterol levels. All of that except the weight now is controllable with generic medicines that are very inexpensive. And if you look at doctors who are in general pretty aware of what the issues are, they're all taking these generic medicines. So we got to solve for the weight loss drugs, but that's going to rapidly evolve because there are dozens of effective weight loss drugs that are going to coming through the pipeline. So the competition's going to pick up. So we got this great body of knowledge and things that work. and we're not applying them. And I think one of the main missing links is the primary care system.
Mhm.
We don't have one in the U.S. It just can't. It's everywhere I go, even professors in medical schools, their families can't get appointments. And, as I've said, little wonder that many people are pissed off at universities because we're all sitting here like I'm in this beautiful Gothic stone office. I don't feel guilty because I practiced for, 35 years, but um, to the average person, they'll say, wait a minute, what's going on? Why don't they make their services available so I don't have to wait 6 months to a year just to see somebody? And the other consequence, I'm going on here, but the other consequence of that, and I'm very cognizant of, partly because I did have 7 years at Alphabet with Google and Verily, as you pointed out, that just leaves a wide open system for misinformation.
Mhm.
So imagine if you think that a clinic doctor seeing a patient for 10 minutes in the clinic while staring at the keyboard and trying to get the billing correct is going to compete with 24/7 nutraceutical advertisements. It's not going to happen. And I think, we're seeing that combination of factors lead to not the progress that we need. It's very fixable. We're spending $5 trillion a year on healthcare, as you know.